Buenos dias. Today we are here at Dr. Luis Picard-Ami's clinic. So let's get to see it. Yesterday we talked down there.
And this is a three-story building. We have a Marriott hotel that has about 15 floors. We have Tower B, which is a hospital that has 27 floors. And then Tower A, which is a medical and a office building, which is 36 floors. And then in the center, we have this area that's shared.
Close to the food court there in the main business center there. I'm not sure how they call it. It's a kind of a mall. Let's take a look here today.
Hi, good morning. So this is my office, Impilo Plastic Surgery and Medical Spa. We have 2 doctors and we have a 7-room spa in this building, and then in another building we have a second spa. But come right in.
An interesting combination. I had never seen it, but I guess
This is our main lobby. From here, patients go either to the doctor's office or to one of the spa areas. Come on in. That's our front desk, which is quite busy. This is the way to the spa. And we have all the different treatments over there. And then the 2 doctors. This is my office. This is where I consult with patients. We have a fantastic view of the Pacific Ocean.
yes, I had commented about that as well.
And then on this side, we have part of the city. So I have about almost 180-degree view, which always impresses people, but it makes them feel very relaxed. We're not in a medical office, we're in a pleasant office. So come on in. This is where I see my patients that already had surgery or physical examination. So first we consult and talk over there and then come over here. And this is a very interesting piece that I got
seen it.
when I first started my plastic surgery practice in Miami. One of my patients gave me this. Obviously, this was like an arts and fair, crafts and fair. And this was already done, but they put in my name. So these are the
Oh,
things we do.
okay.
We have cosmetic surgery where people are old, fat, and after pregnancy, and then they come out thin and beautiful. And then for reconstructive surgery, which is also part of what we do, people are missing a leg or a hand or the head, and we go through reconstructive microsurgery and put them back and make them happy again. So this has been with me when I was in Miami, and the 3 offices that I've been here in Panama, and it will hopefully be here until the last of my days.
The objectiveness of it. I don't know if it would get made today, albeit as a piece of art, perhaps it gets a pass. But I do like how straightforward it is.
So
And-
after we see the patients, we take pictures and we do them right here. So we have 2 backgrounds, a black background or a blue background, depending on what part of the body we're photographing and what is the purpose. But for us, it's very important to document not only the before and after, but the progress, because sometimes patients can't remember from 1 week or 2 weeks that they've made much progress, and many of the surgeries we do take months to see the full result. So we help them by documenting how they looked 2 weeks ago, or how they looked 1 month ago, or how they looked 6 months ago. So photography is a very important part of our office and our process of taking the patients from A to Z.
Difference between the blue one and the black one. Which parts would you use for each?
Well, sometimes when we're playing with the shadows, for example, in the nose, we don't want any colors. Sometimes we take pictures
Okay.
in black and white, and that gives us with the black background is good. Sometimes we want to show something different with more accentuation into the colors. So it's a doctor's choice of what I want to show, and sometimes it's just for just my mood, what I like.
Okay.
And sometimes I tell my nurse, take the pictures, Sometimes I take them, but we make sure that they're always in the same format, at the same distance, with the same flash, with the same camera, so you can compare apples to apples and not apples to oranges.
Okay. And you mentioned this is like our third office here in Panama. Anyone who has ever seen your reels will recognize this view here because we often record facing that way.
Yeah, this is where I do all my podcasts and not podcasts, but or I do all my reels. And I have a professional person that comes once a month, and we make a schedule so that we have a list of what we're going to be posting for the next 2, 3, 4 weeks. So it's all organized. Thank God somebody helps me to do that, and I just talk and do what I do, but somebody else puts it together because it's almost a career.
And you mentioned this is your third office, I think, here in Panama. The first one didn't have any windows,
Well,
and the second one's
over there where we have that glass curved building. Next to it are the medical offices of the Paitilla hospital. That my father was one of the founding members of that hospital. So when I first came to Panama in the year 2000, I worked out of there. But then my father was still working. So after a few years, as he was retiring, we sold that office and I moved to a new building. This building had what looked like prison windows, very little windows. And then when I moved to the new building at Punta Pacifica, I was on the first or ground floor, and I had absolutely no windows. So I took advantage of my wife, who had an art gallery, and we filled the office with lots of artwork, so it wouldn't be so distressing, the fact that we couldn't see outside. But then when I got recruited and came to where I'm right now, the Panama Clinic, I said, I want a big window now. So I made sure I have a corner office where I see the islands, the coral reef islands. I have the Pacific Ocean, and then I turn almost 180 degrees and see good parts of the city. And it's interesting because, as I mentioned yesterday, I live very close to here. So from my house, I can see the islands and all the way out to the east, and I see the other part. So between my house and my office, I have about 300-degree view of Panama City. Well, let me tell you a little bit about how I ended up here. About 10 years ago, I was very happy. Over there, where you see, that's Punta Pacifica, and that's a very nice hospital. But I had some troubles and some things that I wanted to be able to offer to my plastic surgery patients, especially because I had a lot of international patients. So I was approached by the owners of this hospital, the Panama Clinic. It's a Greek family, and they said, we're going to build a hospital, and we're going to make the best hospital in Latin America, and we're going to not hesitate on doing the things that need to be done so that you can offer the best to your patients. So I got on board on the project. I was involved from the beginning when we only had sand here before there was no building. And this is a 3-story building. We have a Marriott hotel that has about 15 floors. We have Tower B, which is a hospital that has 27 floors. And then Tower A, which is a medical in a office building, which is 36 floors. And then in the center, we have this area that's shared. And I am super happy because they were able to make the possibility of the things that I wanted to do. So a lot of my international patients, we have an international department. We can offer concierge service, pick them up not at the airport, we pick them up at the gate. We can help them process the immigration and the customs troubles, which, as you know, TSA is the worst part of traveling, is going through those TSA lines. Here, my patients get treated as if they were diplomats. They go into a room, somebody does that paperwork for them, and then they get picked up with their bags. They escort them from the airport to the Marriott Hotel, which is within the hospital complex building, and they only have to go down the elevator, walk 50 feet, and go up the next elevator and be in our office. My operating room is on the 14th floor. My office is on the 22nd floor. And then in between, we have all the physical therapy services. We have a medical spa, which is called Impilo Plastic Surgery and Medical Spa, which we've grown. We now have about 45 employees. We have 2 clinics, one here and one in another hospital. They treat our patients fantastically for the post-operative recovery. And the best thing is that I live right there. So
Are you sure you want to dox yourself?
yes, I live in one of those 2 buildings there. So when I leave the hospital, I take the highway, and it takes me about 10 seconds to get to my house. When I come in the morning, it's a little more because I have to go through the neighborhood, but it takes me 5 minutes, so I can walk to the hospital. Having all the facilities for my patients and the facilities for me, not having to commute, is the best of all worlds. So that's why I ended up coming from the other hospital to this hospital, which is now home. And everything takes place here. My patients have fantastic care. I don't have to waste time commuting. I can actually walk, and it's a very good, safe, beautiful, and peaceful neighborhood to live in.
Yes, I mean, to each their own. People have different opinions. But there are some specific things I really like. We were talking about before, and I mean, I have no way of like evaluating like the experience of a patient. I've not been a patient, but like when he mentioned this concierge thing at the airport, I kind of really liked it. I almost asked like, hey, don't you offer some kind of package for non-patients? Because he said about TSA and something like that, and I absolutely agree. I mean, from that point of view, I think one of the worst parts of traveling is precisely, for example, having your luggage searched or having to answer questions or something like that. Even if you travel in comfort at the plane and you arrive to go to a great hotel, you still have to go to the very specific problematic place. And just to know that such a service exists, to me, like, shows a great level of professionalism. It looks good. I mean, it means the fact you offer it inside the airport makes you look, at the very least, well connected.
Yeah, well, it's actually it's something that I offer to my patients, but the hospital has an international program, and they can actually, if you're coming for, let's say, heart transplant or a kidney transplant, or coming for bone marrow transplant, or coming for orthopedic surgery, you can contact the international department, and they will connect you with a very qualified doctor and offer you most of the same services. We just have it very well organized. I mean, my patients get a super rate at the Marriott because I always have at any point 5 or 6 patients staying at the hotel. But I've had patients who, for example, they came for surgery, they got their surgery, they left, and we know that they're coming to Panama next month. We can actually register them as one of our former patients, and they get a very good rate at the Marriott as well. So if you're visiting us, we'll get you the rate.
Yes, I mean, that's one of the things I mentioned on my first video arriving here in Panama. These are the sorts of things that aren't directly related to medicine, but are really related to patient experience, undoubtedly. And the hotel thing, one of these days I was talking to my Uber driver here, and oops, come back to us. I was talking to my Uber driver, the gimbal always gets lost. And we were going to Multiplaza, to the mall, and I said, there was a hotel there. And I said, I really like the idea of having a hotel connected to a mall. Because it's practical. If you, for example, if you need to go to the supermarket, you just go down and you don't need to walk outside, you don't need to call a car, you just walk there. And you told me that you will offer the wheelchair patients after the surgery right from the hospital to the hotel without having to go outside.
Yeah, the hospital and our offices and the Marriott Hotel are all within the same hospital complex. So you go down the elevator, go 50 feet, and then you go up and you're in your hotel room. But in between, we have a little mall. The mall has a supermarket, has a barber shop, has cinema theaters. It has a bowling alley. It's got a drugstore. It's got a couple of shops and a very nice food court. So everything is in one place. You come from the airport. I've had patients come from the airport, be here for 10, 12 days and not leave the complex, because even if when you get to the room, you can say, oh, I forgot my medication. Well, they'll bring the medication from the drugstore, which is only 8 floors down. I need this or that, and it turns out that there's a supermarket, and the Marriott Hotel has suites that have a kitchen. So you can go by the supermarket before surgery, stock up in your room, and you can cook for yourself or have the facility of not having to go to the food court or ordering room service. You can make your own coffee. You can cook if you want. If you want to go out, you just go down the elevator. But I mean, it's a very nice setting, and we worked very hard as one of the requisites when we came from the old hospital to this new one, that all of these things would be available for my patients, because I said, I want to make sure that they get a Waldorf Astoria or, a Four Seasons 5 or 6 star a review and a treatment, because not only you want to have good surgery, but you want to have a good experience. And part of the drawbacks or the fears of going to another country is you don't know if the people are going to be able to speak my language, if I'm going to be able to eat comfortably what I want, what are the facility standards. And this basically, I do and work here the same way that I worked in the United States. There is nothing that I was offering to my patients there in regards of technology or patient safety that I'm not offering here. And better, much better, is the customer satisfaction and the experience, because it's very difficult in the United States to have direct contact with your doctor, with your nurses, and have everyone in the team available for you 24/7. And we've been able to provide that here in Panama. This is the office. This is where we do one half of our work. The other half is inside the operating room. So let's go down the elevator a few floors. If I were not recording, I usually use the stairs because it's very good exercise.
Oh,
To go down and sometimes to go up.
We are here.
Certainly to go down, I use the stairs most of the time.
here we are on the 22nd floor. Which floor is the operating room?
14, the one where
14.
it's on the
Okay,
14.
okay, fair
Not
enough.
bad.
7
Yeah.
floors.
Yeah.
Well,
On the way down it's very easy, but sometimes after surgery then I'm tired, so then obviously I take the elevator. Here it's very easy because these elevators are only for patients. Like these elevators will work between the emergency room, radiology, or the admission offices of the floors where patients actually stay. But for people who are coming to the medical offices, they can't use that, so it's not as congested. So let's go down the hall. So this is the lobby of all the medical offices that are here. The hospital goes from the 7th floor to the 20th floor. And then from the 21st to the 27th is medical offices.
habitaciones are the patient rooms.
Yeah, patient rooms are 16, 17, and 18. Okay, so this is obviously a restricted area. You need to have a pass to be able to have access.
I'm getting pretty much proficient at recording at places that have like no recording signs, because people tell me, okay, you can record here.
Outside, This lobby is just for the ambulatory services. So over there we have ocular surgery. So anybody going into ophthalmology will have go through those doors. And down this hallway we have the facilities for endoscopy. So that's also an outpatient procedure. And then to the left we have our ambulatory surgical services.
How many operating rooms do you have here on this tower?
On this floor, we have 5 endoscopy suites, 3 ophthalmology operating rooms, and 3 rooms for plastic surgery. Then on the 11th floor, there's 4 rooms for all kinds of other surgeries. But mostly are people who stay overnight. All the ambulatory services, like urology or a quick procedures is do here, and all of plastic surgery is done here. So the nurses and everybody is sort of so specialized into plastic surgery. Whether the patients are ambulatory or they stay in-house, they're done on this floor.
Are there ORs on the other towers as well?
No,
just
is
this
only
one.
on this Tower B. Tower A is the Marriott Residence Inn Hotel, and the other tower is the
Non-medical.
non-medical offices. Although there are a few doctors that have their office there, it's mostly a commercial headquarters of international companies or banks or lawyers or any of the others that are not. And those have a separate pass access. So those who have an office there and come here need to have 2 of these.
Oh,
So over there we have the recovery room for endoscopy. And
yes.
since there are no
Okay,
patients,
there are no
you can film,
patients. Fair enough.
but it's very well staffed and very nice facilities. Okay, so they're having their Christmas operating room.
Christmas surgery.
No, actually Christmas a gift exchange and a breakfast.
Oh, interesting.
Yes, I went by earlier and donated 2 gifts because what they do is all the doctors bring gifts and then they make a raffle. So some of them will get something to drink, some of them will get something to eat, but we raffle all kinds of things. So coffee pots, art, electrodomestics. Each department has their own. So the people from the 14th floor and the 11th floor, all the surgical staff have their Christmas breakfast today.
That's a really interesting point you raised. This is not so much to patients, but to medical doctors, a question. Are there any differences like in the operating room between the United States and Canada versus Panama? For example, I'm aware myself that there probably are, because in the United States they have a much more like throwaway culture. You use an instrument once and you throw it away. Is it not kind of like that?
It's exactly like that, and that's why when some patients compare our prices to other Latin American countries, we don't do well. We're definitely more economic than Boston, but we're much more expensive than Colombia or the Dominican Republic because our hospitals are Joint Commission accredited, meaning that they go through the same safety and protocol checkups as the United States hospitals do. So we can't do things that are not right, or we can't cut corners because we're being checked every 2 years. The team comes down, they look at everything, they look at our protocols, they look at our results. We have all the statistics of how many patients fall off their bed, how many infections are recorded after surgery, what's the response time if someone has a stroke, what are the results of if someone has a myocardial infarct, so what is the outcomes of people who show up to the emergency room. All that is being monitored and is being reviewed by third parties outside, so we're up to standard. I cannot say that of all the hospitals. There's some very good hospitals that maybe they are as good as we are, but they're not certified. Now, having the certification is like when patients look my record and they say, oh, he's certified by the American Board of Plastic Surgery and by the Royal College of Canadian Surgeons, he must be up to that standard, and I can verify that. So I think that's very good way for someone who's coming from outside to be sure that they're coming into something that's up to standard that they're looking for. But we much more focus our attention into providing the right care, the safety care, and not having the cheapest option.
Well, I do have like my questions about some specific policies, but I'm going to save that for my interview with the Joint Commission International Employee. I don't have one scheduled. The day I have one question then about how they came to this specific. But overall, what you're telling me is that if an American surgeon came here, for example, he could easily operate on the OR and you see basically no difference whatsoever.
Exactly. I mean, at least in plastic surgery. I mean, I don't know for other specialties. I know that urologists have their Da Vinci robot, so I know that they're doing actually, they had a conference here last month where the patient was being operated here, but the surgeons were elsewhere because they were working through the robotics of a Da Vinci. That's very highly specialized care. In plastic surgery, we don't depend that much on the instrumentation and on special technology. It's a lot more art. So there's nothing that I can't do here that I was not doing in Miami or that my colleagues are not doing currently in other places of the United States. That is, I can speak for plastic surgery. I don't know of other things, of other subspecialties, but definitely we have here everything that I need for my patients. If it were a rare, let's say, congenital anomaly, that something that I don't treat and that the hospital has or the children's hospital has very limited experience, then yes, I would go to a tertiary country, because it's not the same if someone's doing this surgery once a month and if they're doing it every day. But for what I do in plastic surgery, which is facelifts, body work, or breast work, I do this every day, and I've been doing it for more than 35 years. So I know that I'm doing exactly the same thing that I was doing in the United States with the same safety standards. And when I go to all my surgical conferences and speak to my colleagues, we're all doing the same thing. This is global medicine. There's nothing that's what is invented in Brazil that people don't have access to it in India or in Australia or in the United States. We all share the knowledge. And for example, I am committed by my American certification to have X amount of continuing medical education. So I go and see the same seminars and the same webinars and go to the same conferences and speak to the same lecturers as my colleagues in India or in Brazil or in the United States. It's not like it was when I started, that you would go to the conferences and see these people, oh my God, they're doing something very different that I can't. We're doing exactly the same thing. That's why we can offer first-class medicine, at least in plastic surgery, to our patients with the standard of care of any well-known place in one of the best places in the world, and still provide the type of experience that's much better, much more personalized, much more caring. And I look forward to seeing some of you in Panama.
For sure. Everyone has curiosity. I could let's go and look into the OR of this specific hospital. But to a large degree, like we were talking yesterday about the beauty of medicine, how it's kind of interchangeable, I wouldn't expect the OR here to be very different from the OR in Brazil or in the United States or anywhere else.
Most modern hospitals have a standard of care, and then you're going to find everything. Most of them have restricted entry to the personnel, and then, for example, here there's 2 levels of security: one to get into the hallway, one to change, and then there's a third one to actually go in the operating room, and everybody that goes in needs to have been registered and have a pass that says that they're either a nursing personnel or physical therapy personnel or doctors. So there's no one that can just walk in and go through the three different securities. It's very well kept. And then inside, we're not recording because obviously there's issues of patient confidentiality. So we are not going to record any patients or any surgical act. But believe me, behind the doors, there's a lot of things happening.
That's the beauty of medicine in part. If you have, like, for example, if I was interviewing a lawyer, you couldn't be a lawyer in Panama and then move, for example, to the United Kingdom because the laws change. But medicine, the human body is the same everywhere. So if you know medicine, you can pretty much do the same medicine everywhere. And unknowingly, you pretty much answered the question I was going to ask to other medical doctors, not you, because you're a plastic surgeon, but while visiting some of the hostels, I was going to ask, what are the things you would recommend someone not come to Panama for? And you've pretty much responded. Anything rare that requires, like, consistency in performing the surgery to have the practice.
Yeah.
For example, if you want to do like a combined heart and lung transplant surgery, is Panama the right place? I don't know. I would have to ask for a transplant surgeon.
Well, everybody's different and everybody's condition is a little different, but we have heart surgeons here. We're doing heart transplants. We just started a few years ago. So if you tell me the amount of heart surgery that's done here as opposed to, let's say, Texas or any of the teaching hospitals in the States, they do much more. So if you have something that's very complex or very rare, it is probably a better option to go over there. But for many and most things in medicine, whatever they're doing there, they're also doing it here. They're also doing it in Brazil, and they're also doing it in Belgium and in Australia, and it's making a click with the surgeon. I think you have to evaluate your personality, your problem, and the particular surgeon. You can't generalize that, oh, prostate surgery is better here or facelifts are better there. It's a surgeon, and is that the right surgeon for you? And
Us as doctors come into this area, which is where the patient's family stays. They have a screen that tells them if the surgery is finished, if they're in the recovery room, and we usually go and talk to the family and tell them that everything went well, or if we have any special news about what the procedure, that's where we talk. And then we disappear into a resting room, and this room, not very fancy, but it's got water, it's got some cookies, and it's got coffee, and it's got the computers where we have to record and put in input
Chart, like they say in
all the information about the surgical procedure. There's a surgical protocol that we have to follow and put all the details. Everything is computerized, so nothing. I don't even have a pen, so everything is computerized. I do have a pen, but I don't use it much because everything is on the computer, and it's a closed system for the hospital. And it's interesting because some of the since you're from Brazil, it's in Portuguese. I guess that's where they bought the system from, because I work in Spanish, but there's some descriptions or some keywords that are still around the program that you find them in Portuguese. But anyway, each hospital has their own.
And you mentioned that hospitals in Panama are more expensive than other Latin American countries, such as Colombia, for example, in part because they adhere more to, like, American standards.
well, not only we adhere to it's not that they're American standards. There are many European standards that are higher than American standards. We go by the highest standards, but we have a US dollar based economy. So by not having the facility that $1 is going to translate into 100,000 pesos of another country, then the exchange rate is not as favorable. But again, we are still more economic than in the US, and we can offer you a much better customer experience. So, there's some trade-offs. We're not as cheap as somewhere else, but you're going to get a very good care, and you're going to still save some money and maybe visit some of the country after you've recovered completely. Because don't think that you're coming for surgery and a vacation. You come for surgery. When you're done with the surgery and your recovery, then you can do a vacation, but you're not going to recover at the beach. That's not. We're going to go through the physical therapy, and you're going to go through the same things that you would go in any place that's doing the right thing.
A very reassuring message. Something I was going to ask you about as well. You mentioned that each hostel has their medical records. You said the room is not fancy. The fanciest thing here is undoubtedly the view, because we're in a tower, so every floor has views. Do you use like some kind of integrated service? Like, for example, here, if the patient like has to go to the emergency and he goes to emergency at another hospital, and then they do a CT there, and the patient 1 week later comes to you, do you have any way to request that CT from the other hospital?
I can request it, but the patient has to give permission. And the way the patient gives permission is that there is a website that you get sent, and it says the name of the patient, the password, and if you're the treating physician, a consulting physician, or if you're the patient. For example, you get lab work done, you get that link sent at home, and it says, you want to see your results? This is your password, and you have to put your username, your password, and then you're the patient. If I want to see the record, I have to put my username, the same password, but then I have to say, because the patient authorizes and sends me the password, and then I have to say I'm the treating physician. So yes, you can have access to from outside, but only if the patient gives you the password, because the password is for the patient. But it's the same way that I get records when the patient comes to see me, says, oh, my implant, I think my implant is ruptured. I had a mammogram 3 days ago. I said, what hospital did you have it? I go into the hospital, and then I said, okay, radiology results. My name, give me the password, treating physician, and then everything opens up. If she doesn't give me the password, I get nowhere. So this hospital is integrated for the whole hospital, so I can see patients' x-rays, patients' labs, what's happening on the floors, what's happening in the emergency room. I can see all of that when I'm in the hospital. When I'm in the 22nd floor, I have no access to anything on the hospital. And then in the hospital chart, I need to be a physician of the patient that's admitted, or I will not have access. So I can't see the medical records of everybody that's in the hospital. I can only see the medical records of the patients that are under my care or where I've been consulted. So like if I know that someone's having surgery, but I'm not their doctor, I can't go in their chart and find out what's happening. I have to be part of the treat team in order to have access.
Yes, this is the sort of thing that should be basic. It's like the credentials to enter the room, but I've seen it go awry a few times in places that did not have it. For example, public hospitals in Brazil are often a bit more on the primary side.
Wow.
Once in the hospital I studied, I went to med school, they stole like $20,000 worth of endoscopy equipment because there was no credential. So someone, of course, the criminal knew what he was doing. He just put on a white coat, dressed well, put on a white coat, pretended he was like a physician, went into the room, picked it up, put in a bag and walked out. And because there's no credential, everyone just looked at someone like in a white coat. Okay, he's a doctor.
No, not that of course. But I remember when I was training, we used to have a little card with all the physical charts, and all the charts had the patient's name. So if anybody was walking by, they could see, Ricardo, whatever, or John, or say, oh, my cousin is here. So that cannot happen. And I remember the transition when I was finishing medical school, that the card had like a little blanket so that people walking by could not see what was the name of the patient admitted. Now everything is electronic, so you can't, there are no actual physical charts. The physical chart doesn't have anything. There's just a medical metal chart where, for example, the written permission for surgery goes and some other documents that need to be signed. But there's absolutely no clinical information on the patient, and that doesn't even have a name because that's just to give the patient so that they can sign. But then that goes into electronic and it gets lost. You can't find it unless you have access to that patient's medical records.
And you said that about 30% of our patients come from the United States yet.
Yes.
And are these patients that already know you, for example, who know your colleagues in Miami, or are the main motivating factor for them price? Because we're still cheaper than the United States.
Yes.
Are these people coming here to Panama because they know you personally, or mostly because they want a cheaper experience than the United States?
Well, I think it's a combination of things, and it's changed over the years. When I first came, I was getting some of my patients that would have had surgery with me in Miami, and because I sold the practice and moved, they said, "Oh, I'm willing to go to Panama and have the surgery." And I said, "Well, that's fantastic." But then they told their friends and their relatives, so some people that did not know me started looking at the option of coming to Panama. And I have an amount of patients that come to Panama for that, but the majority, I would say, that are people who have decided they're going to retire in Panama, or they're considering retiring in Panama, and so they sell everything, and when they're ready to move, as part of their new life as retirees, they come to Panama, buy a home, start a business, and get a facelift. And that is a big percentage. So there are people who recently moved to Panama, or are planning to move to Panama, or move to Panama and they're already established, but they want to have some cosmetic surgery, and they find me. The fact that I have U.S. board certification, the fact that I'm on the American embassy list of doctors, or that if you Google and you go, oh, plastic surgeons in Panama who trained in the United States or who have board certification, then I go high on the list. And when they start looking at the reviews, the first thing we say when we contact the patient, let me give you some names that the people you can call and write to, because don't believe me, believe what they say. And that's worked out quite well.
So mostly more expats than medical tourists.
Yes.
A lot of people who actually move to Panama.
Yes.
And then
yes.
more of an expat market.
Yeah, expats or related to expats, because for example, I have a lot of people who they moved to Panama and their sister was considering surgery, and they said, oh, no, wait, come to Panama. I have this surgeon that I know who does good work, and then they will come to Panama just for the surgery and leave. That's maybe about half. But the other halves are real expats that are getting surgery for themselves or their relatives. And there, many of them, I find that as part of their process of moving to Panama was buying a house and getting a facelift. And I'm happy with that.
Well, thank you for talking to me. Thank you for having me. Goodbye. And I hope to perhaps see you again, perhaps you here in Panama. Thank you
Sure.
for showing me your clinic and talking about it.
Well,
It's been
Ricardo, it's been a pleasure for me to show you part of my daily life and what I work for. I'm going to leave you now because I have to go and work. And we're going to leave you with our spa director, Carla Schellink, and she's going to tell you a little bit about the ancillary service that we have available for our surgical patients and for patients who are not having any surgery, who just want to have a spa treatments to get to beauty and to stay beautiful and to feel beautiful. Okay? Have a fantastic day.
Thank you for having me.
My
Have a
pleasure.
nice day of work.
Okay, take care.
Goodbye. Well, hello.
Hello.
How do you do? A Pleasure meeting you. What's your name again?
Hi, my name is Carla Schellink. I'm the spa director of Impilo Plastic Surgery Medical Spa.
Yes, Dr. Luis told me that your husband is his partner here, also a plastic surgeon, works with the beauty pageant, Miss Panama. And he told me when we were talking yesterday that you have two plastic surgeons here and a spa. And I was even like, well, does the hospital allow that?
Well, we're a medical spa, and also he's the plastic surgeon of Miss Universe Panama. But yes, we do. We have two plastic surgeons here. We have aesthetic medicine doctors. We have physical therapists. We have nurses. We have spa therapists. We have the whole team to make sure the person has the best possible way to recover and then to maintain the results over the years.
And then he told me that you had some experience with spas and perhaps hotels or hospitality in general. And that when your husband decided to open the practice here, you also wanted to bring the spa here. And he told me that Impilo is perhaps Zulu, I think.
Yes, actually it means to heal in Zulu or Xhosa. It's like two dialects of South Africa. So because I'm South African, we thought maybe we'll have a different name for the clinic, because it was a little bit difficult to think if it's Dr. Luis Picard-ami or Dr. John Wilson Clinic, and how do you match which name goes first or the other one. And something to like integrate all the services, because we're an integrated clinic that offers everything to the patient, from laser hair removal, facials, post-surgical treatments, body contouring, chemical peels, laser, Botox, all those type of treatments. So we try to combine all of that in one location.
And had you ever like worked or been in a place that combined like medical services and spas? Is that like a usual thing around?
It's not very common in Panama. In the last couple of years since we started it, the trend started following. But yes, I worked on the cruise ships for Royal Caribbean Cruise Lines for many years, where they have an aesthetic medicine doctor that does injectables, and they have spa and gym and salon.
Inside the cruise?
Inside the cruises, yes. And on top of that, I worked for many years in Dubai and Abu Dhabi in a medical spa where they had flotation therapy, beauty services, and Ayurvedic doctor. But it wasn't so focused on injectables or stuff like that.
How long did you stay in Dubai?
For 2 years.
Did you learn any Arabic?
If I can think about, I think Habibi is like my love, something like that. But not too many. No, the owner of the company always spoke English to me, so.
لا أعرف كل شيء باللغة العربية لكن عندي دروس.
No, I have no idea what you're telling me. But I learned Spanish. We can speak fluent Spanish. I mean, I've been in Panama for 8 years and I speak fluent Spanish, so.
Yo no hablo español muy bien. Yo hablo portuñol.
Ah, no, pero lo hablo muy bien.
Pero yo intento aprender los idiomas de los lugares onde yo estoy. Donc, yeah, so that's why I know a few words of Arabic when you said it, I thought about mentioning. But do people really go on a cruise to have like aesthetic procedures?
Yes, it's surprising. I mean, I personally wouldn't go on a cruise and do aesthetic procedure, because I would want to enjoy the cruise and the stops.
Exactly.
But a lot of people, they go on a cruise like as an excuse. Like, I went on a cruise and they come back refreshed, but they actually just go for the aesthetics. And I think it's a little bit more economic doing it on the ship than doing it in the United States.
Sure, because like the employees perhaps are, well, they are paid in dollars, but like labor regulations are different and all of this, because you're like in international waters.
Exactly.
Like we see a lot of this with casinos in cruises in Brazil, for example. Casinos are not permitted in Brazil, but if you are in international waters, then you can do it. So perhaps it has something to do with regulation. But it's kind of like, for example, now they're releasing in theaters like the new Avatar movie right now. And I'm here in Panama, and I thought perhaps I should go to the cinema. And that thought crossed my mind for like 2 seconds. And I was like, of course not. There are cinemas all around the world. I can go watch a movie once I'm back.
Exactly.
Once I'm traveling, I'm going to go and see things, not go to the movies. So the cruise is kind of the same idea. It's kind of, hey, you're in a cruise, so perhaps go do aesthetic procedures before or after.
Exactly. I'm not sure why people would do it, or maybe they get inspired they get to the spa and then they offer the service. I think, why not? You know.
But well, it is an interesting thing. Here specifically in this very building, in this very tower, I've seen some combinations I'm not that used to. For example, here we have a private clinic that's like intimately linked with the hospital. You take the elevator and you go to the OR. I don't know, perhaps in Brazil it's not that common. Here most clinics are perhaps share the same building with the hospital. Even if it's a private clinic, you're not like an employee of the hospital, you still have it in the same building. And so these sorts of combinations like spa and plastic surgery, it's interesting. I've never seen it, but it's kind of like having a hotel inside the mall. There's the obvious convenience of being located inside the mall. It's something interesting to watch.
Did you see we have the Marriott Hotel here in the ground floor?
Yes.
So a lot of our international patients that come for surgery, they stay in the hotel, they come for the procedures, they come for the post-surgical treatments. It's very convenient. They have a supermarket right here. They have everything here in walking distance. So it's almost like being on a cruise because you have everything right here.
Dr. Picard told this, that people get wheeled from the hospital to the hotel over a connection there. And that since it's I think residents, since they have kitchens inside the apartments, so you can even cook. Yes, there is. It's the same thing we were talking yesterday about, like immigration procedures and bypassing it. There's a lot of convenience to be gained in some of these combinations.
Exactly. No. We're here for any person that wants to come and have a prosthetic, anesthetic procedure done. We can attend to them in English, in Spanish. Maybe in the future in Portuguese. So yes.
But well, thank you for having me as well.
No, thank you for having me. It was a pleasure
about
meeting you.
Your spa.
So welcome. Thank you.
A pleasure meeting you. Have a
Bye-bye.
nice
Thank
day.
you.